We've been talking with Dr. Dixon, and recently Dr. Willis just joined us, and we're glad that you are now able to join us. And we're going to provide you an opportunity to just go ahead and put your plug in what you has to say about the topic about biases in healthcare and the effects on patient outcome.
Well, thank you for that. I think it's a very important topic as bias. I'm not sure what was discussed earlier, but I do know that bias typically impacts people of color often. So it is something that is very near and dear to me. Um, being, having to be on the receiving end of care and people listening to me or maybe not listening to me when I've had things going on. So my biggest take on it, I'm sure Dr. Dixon has covered a lot, but my biggest take on it is alerting the providers to how to recognize bias. A big part of bias is like what was your self-reflection? So making sure you remove that prior to taking care of any patients and making sure that you're able to look at the patient from a holistic perspective and not including any type of bias or anything in your care, and also being able to recognize that if somebody calls you out on it. The big thing for me is being a person of color, knowing when to recognize that and knowing how to educate the community on what to look for. Because the big thing
Yes.
is educating the community on what questions they need to be asking the doctor. For example, I can educate my church members often on like creating a list before you go to the doctor of like your 3 or 4 common like the issues that you want to discuss, and you don't let that doctor walk out of the room until they address those issues. Because if you don't have a time to collect yourself and put your notes down, then they'll kind of rush you through that appointment and you won't feel like anything is accomplished. So that's one of my biggest things. And what I'm
Okay.
passionate about is making sure that we educate the community on their rights and what they should be doing in order to be more engaged in their healthcare. So I'm sorry if I'm repeating what Dr.